All right, it looks like everything is working now. I do apologize for the delay. I was having some tech issues on the back end here, was not letting me log in, and I do apologize about that. I know we're 10 minutes behind. I see a couple comments here from people that are looking for the live video. So I'm going to give everybody just a minute to tune in and to hopefully be able to see everything and hear everything. So as you're tuning in, if you could please just put a comment that if you can hear this, if you can see everything and everything's okay, I would love for you to just put a comment that says yes or something like that so that I know everything is good. So I'm going to give just a minute here because I know we're a couple minutes behind for people to log on, and we'll get everything going. Let me get my microphone just a little bit closer. Hopefully you can hear me now. Awesome. Thank you so much. Let's see who... I get my comments up here. Okay, so hopefully everybody can tune in. Hopefully everybody can see me. For those that I have met before, thank you so much. Welcome back. For those of you that I have not met yet, my name is Jason J. Hamilton. I'm the founder of Keep It Simple Financial Planning, a registered investment advisor in Orange County, California, and also the founder and admin of this group. This group, Your Retirement Coach, is for you to come in and learn more about retirement. I love the community here, such great responses, such good information. But what I want to do sometimes is just add a good amount of technical information that is laid out in a way that hopefully you can understand easily about these retirement subjects that are a little bit more complex. We did multiple weeks of Social Security. We covered a ton of stuff about Social Security. So if you want to learn more about Social Security, please go back through those videos. I try to keep these trainings about 20 to 30 minutes max, just because our brains sometimes, especially on the weekend, cannot bring in more than that. So as I mentioned yesterday, we're going to start today's training on healthcare in retirement. We're going to get some details, but it's going to be more of an overview. And then over the next few weeks, we will be covering a lot more about healthcare and retirement. And I'll be doing my best to answer your questions. There are some questions in here that are just very specific, and that, in all honesty, I'd have to have a contract with you to advise you on. But there are some good questions that we're going to answer throughout the weeks here that people have asked that I think are great questions that everybody can benefit from. So as we're getting this training going, if you have questions, please drop them in the comments. I will do my best to take a look and to answer them as we're on the training. And again, if it's very specific, it's going to be tough for me to answer those. But if there are general questions about Medicare or anything like that, then I definitely want to do my best to answer those. Okay. So for everybody that's on, welcome. Thank you so much for tuning in. Today we're going to talk about healthcare, and this will be the first in a series of healthcare trainings. So as I switch over here to this screen here, see if I can get this up and that if you can see me okay. Let's see here. All right, if you guys can tell me if you can see this okay, please give me a thumbs up or just say yes in the comments. Let me know that you can see me all right and that you can see me in the bottom corner. I would appreciate it. I know it's a little bit of a delay, so I'm going to give you guys a second to let me know that you're here and that you can see everything okay. So if you can, please, in the comments, drop me a thumbs up. Let me know. Yeah, it looks like everybody can see that okay. Okay, perfect. So, we want to go to the screen here. All right. So today we're going to talk about navigating healthcare options in retirement. This subject, especially for our early retirees in the group, is probably one of the most stressful, unexpected, unplanned for subjects that comes up when we're doing our retirement planning. We save money, we put money away, we have our retirement accounts, we know what we're spending currently while we're working, but then when it comes to healthcare, if you want to retire before Medicare kicks in, out of nowhere you have this extra, maybe it's $1,000 to $2,000 a month that you need to plan for. And it can get really expensive really quickly, and I think it throws people's games off when it comes to their retirement plan. So it's tough, but it is what it is. And at the end of the day, we have to have health insurance to cover us before Medicare kicks in. So we're going to talk a little bit about that, and we're also going to talk about Medicare and overall the basic plans there. And I'm going to give you some tips and tricks on how to make good choices when it comes to that. As a disclaimer, everything here is for informational purposes, okay? Please do not take anything I'm teaching you today as specific advice for your situation. But at the end of the day, we all have to make these choices. So I want to give you the best information I can, but this is for educational purposes. I do have to put that disclaimer in there, okay? Dave Smith, looks good in Texas. Thank you so much for that comment. I appreciate that. Thank you for sharing, for letting me know. So I want to get a little bit of the background on healthcare and why it's so important and some of the costs I think that you should be thinking about when it comes to planning, okay? So today's average senior citizen is in better health and is more active than his or her counterpart was in any previous generation. And my biggest fear for the folks that are going to retirement is that you think you're just going to pass away early, okay? In reality, if you're already 60 years old, there's a very high likelihood that you're going to live into your 80s or even your 90s. So planning for healthcare and covering your expenses way into those dates is going to be much more common. We're going to start seeing a lot more people living over 100 over these next 10 to 15 years. And 60, you have to believe, is actually a little bit on the young side. You have to believe that. I know some of you feel you're older, you're tired, you want to retire, but in reality, you may have 20, 30, or even 40 more years to be planning for expenses, and healthcare is definitely one of them. If you are younger than 65 and you want to quit your job because you feel like you have enough money, well, what you need to do is plan to cover that gap, okay? And you just got to set aside a budget and make sure that you can cover it cash flow wise, and it shouldn't be a big deal if you really are ready to retire. But however, there is a great deal of variability in the health of older people. So many are very fit. I've seen some of your pictures here that some of you are literally more ripped than I have ever been, and I work out 3 to 4 times a week. And you guys are in awesome shape. But for others, maybe there's mental or physical incapacitation that may require assistance for daily care. That's something we forget about sometimes, is that our bodies may be healthy, but mentally, we may have some challenges that may require additional care. So when it comes to long-term care, if you mentally can't take care of yourself, then you may have to actually kick in that long-term care early. So that's something to think about. Okay, some older folks are afflicted by chronic conditions that require expensive medical attention. So even retirees who are relatively healthy for their age find themselves spending more time in the doctor's offices and drugstores and undergoing expensive medical procedures to deal with an array of problems. In April 2018, an EBRI study was released. That's Employee Benefits, something institution, but was released that described the cumulative out-of-pocket healthcare expenses after the age of 70. I thought this was interesting because they're a lot lower than you may expect. But unlike many other studies, this includes only expenses for healthcare services actually used. So, for example, Medicare and insurance premiums are not included. And it is based on self-reported expenses of actual retirees and not on projections for hypothetical individuals. There's a lot of things going on in the news, and I've shared some things here too because, they're research studies. But like Fidelity, for example, I believe it was about $260,000 or $280,000 was the expected amount that you need to have put aside when it comes to planning for health care in retirement. But these numbers were adjusted for medical inflation and reported in 2015 dollars, okay? But the study just came out. So here are the key findings. So the majority of people surveyed, out-of-pocket healthcare expenses are not as high as commonly believed. For those who die at age 95 or later, the median cumulative out-of-pocket expenses after age 70 until death is slightly above $27,000. That's kind of crazy when you think about it, that's the average median, I should say, out-of-pocket expense. You would think it'd be a lot more. But these expenses are catastrophic for some, and this why you have to plan, right? At the end of the day, regardless of what you think is going to happen, you still have to have some money set aside in case you have some catastrophic situations. So for those who die at age 95 or later, the 90th and 95th percentiles are nearly 172,000 and just over 269,000 respectively. So in other words, the distribution of cumulative out-of-pocket medical expenses is skewed toward those with higher expenses. So there are going to be some of you folks that have higher. If you don't plan on it, you may burn through all of your retirement assets and run out of money before you essentially finish the end of your life, which is sad to say, but it is what it is. So we have to plan for that. If you run out of money, then you're going to end up dealing with things like Medicaid, and it just gets really, really bad. So I would love for you to have enough money put aside or some sort of long-term care insurance so that you can get the sort of care that you need, and that goes into your medical expense planning when it comes to retirement. So nursing homes are one of the biggest contributors driving the skewness of distribution. So what that means is the cost of nursing homes are what's driving the big expense difference. But without the out-of-pocket nursing home expenses, the 90th and 95th percentiles for those who die at age 95 or later drop to $96,000 and $154,000 respectively. So that's a pretty significant drop. The cost of care can be very expensive when you're in a long-term care facility. The average stay in a long-term care facility is about 2 to 3 years. I still share the story. My grandfather passed away just a few weeks ago. He was 97 years old, and he had some sort of care for 13 years, okay? So 13 years, if you're looking at care that's maybe $45,000 to $95,000 a year, as you can see, that can add up very, very, very quickly. So for all surveyed people, the median out-of-pocket nursing home expense is zero, because just like this distribution of total out-of-pocket healthcare expenses, the distribution of nursing home expenses is also skewed towards those with higher expenses, which means a smaller percentage of retirees face higher expenses. For those who die at age 95 or later, the 90th and 95th percentiles of nursing home expenses are slightly over $87,000 and $175,000 respectively, okay? So somewhere in that range is normal, but again, with the advances in healthcare, just because you are alive or just because you are overall bodily healthy, maybe you have some mental things that are going on that you need some additional care. So this can last for years, but these are the real numbers from retirees that have actually lived to these ages and paid out of pocket. So when the sample is restricted to include only those who entered a nursing home, the 90th and 95th percentiles go up to nearly $182,000 and $266,000 respectively. So as you can see, the cost of entering a nursing home is extreme. It can definitely be very, very high and, really hit some big numbers if you go into there. So something to consider when it comes to planning your long-term care. But there are significant differences between men and women. Women are significantly more likely to enter a nursing home after the age 70. So it's 38% of men versus 51% of women. So in traditional sense, women live longer than men. And so, a lot of times the men can actually be taken care of by the women. And a lot of folks do the in-home care. Maybe they hire a little bit of part-time help. But a lot of times the wife will help the husband out with, the basic things like dressing, making food, and things like that. But if the husband passes away and you are left as a female spouse, then this makes sense why the likelihood of entering a nursing home is much higher for women, right? It's pretty straightforward with that. Hello, Barbara. Thanks for the comment. Thanks for coming, showing up. I'm going to stop real quick and mention Brian's comment. So Brian has a comment about I love real life situations, but he says these final medical costs can be huge. His mother passed away in 2016 at 96 years old. Her total medical expenses in her final 2 months was $125,000. Luckily, she had Medicare, Medicap, and TRICARE to cover all that, but $277. So 2 months, $125,000. That's extreme. But the nursing home care is not going to be covered, right? So that's something you have to pay either from your long-term care policy or pay out of pocket. So, but that's pretty insane to see that $125,000 in expenses in 2 months is what people are seeing. So, but also women who live long enough to spend significantly more than men with similar lifespans. So, for example, the 90th percentiles of out-of-pocket nursing home expenses for men and women who die at age 95 or later is about $77,000 and $99,000 respectively. Okay, so longevity has a very strong positive correlation with nursing home entry. Makes sense, right? The longer you live, the more likely you are to be in a nursing home. So total out-of-pocket healthcare expenses and out-of-pocket nursing home expenses. 1 in 3 of the surveyed retirees are covered by Medicaid after the age 70. The cumulative expense numbers for the age 70 to death period should be interpreted more as a lower bound than a true estimate. A slightly better measure, though not perfect, might be the average annual out-of-pocket healthcare expenses. Awesome, Jim, you made it. Great to see you here. So here's a likelihood that you would enter a nursing home, after age 70. Right now, the current likelihood is about 45.9%. 54.2 about that are not going to enter a nursing home. So when you're thinking about long-term care insurance, here's the numbers. 45% are going to enter a facility, and having that long-term care insurance is going to be massively beneficial. But if you don't, you're taking a little bit less than 50-50 chance. But if you do enter, it's going to be so expensive that what I usually recommend is let's look at the numbers of what your break-even point would be, right? So if you're paying, say, $6,000 a year for a long-term care policy, how many years do you need to pay that for you to hit break-even? And then, if you were to enter a facility, what's that break-even point where you'd be ahead and not have to pay out of your assets, right? So it's, at the end of the day, everything's a risk. You either risk paying out of pocket and maybe you lose that money because you never enter, but it could be a bigger risk of not having any coverage, and then you do enter and you burn through all your assets and then run into some sticky situations later down the road. So incurring large medical bills after an illness or injury is one of the most significant financial risks a person or family faces. Health insurance is designed to help people manage that risk. That's the whole point. But even with insurance, there can be significant out-of-pocket costs due to deductibles, co-payments, co-insurance, and high stop-loss limits. So in addition to a health insurance plan, individuals and families would be well advised to also have enough cash reserves to handle a catastrophic medical event. While most routine medical issues are relatively inexpensive, the cost of doctor visits and prescriptions can add up over the course of a year. Most individual health insurance policies require the insured to pay for a significant portion of these costs until the deductible amount is reached, and then additional costs until a specific maximum out-of-pocket amount is reached. Additionally, the cost to consumers for health care continues to increase each year as the cost of care itself rises, deductibles increase, and out-of-pocket maximums increase. So here's something that may be interesting. I follow a lot of what's going on in medical technology, because medical expenses are obviously one of the biggest things we need to plan for when it comes to quality retirement strategy planning, right? So right now, these costs have been going up like crazy. Believe me or not, in the next 10 to 15 years, we may see a lot more robots or robotics get into the situation when it comes to surgeries and medical care, artificial intelligence when it comes to diagnosis. We're seeing it already a lot in the legal field. I don't know if you've heard of Watson, but there's a big chance that basic legal procedures and things like that are going to get done by artificial intelligence. Same thing's going to be coming to the medical field. So the expectation is in 10 or 15 years, costs are actually going to drop, but we can't plan on that necessarily. We need to plan for today and what we know today as far as the costs that are increasing. But keep an eye on what's coming because it's really interesting stuff. So having a coordinated plan that includes health insurance and savings is important to managing the cost of healthcare and is an essential part of any financial plan. So let's talk a little bit about policy types, okay? So there's individual health insurance policies. Before Medicare, this is definitely something that most folks are going to have to deal with. So let's talk a little bit about that. So prior to the enactment of the Patient Protection and Affordable Care Act, otherwise known as Obamacare, hospital surgical policies were available that were effectively basic health insurance plans with low maximum benefit amounts. So they paid for hospital expenses, surgical expenses, outpatient services, and doctor visits subject to a deductible and coverage limits. Often a flat dollar amount or based on a determination of reasonable and customary charges for the service. With the enactment of the PPACA, all health insurance policies must now include coverage for the 10 essential health benefits defined in the law. Consequently, the number of options for health insurance plans has been limited to plans that meet the requirements of the law unless grandfathered. So here's the 10 requirements. They must have outpatient care, emergency services, hospitalization coverage, maternity and newborn care, mental health and addiction treatment, prescription drugs, rehabilitative services and devices, lab services, preventive services, and pediatric services. So if you're looking for health care before you qualify for Medicare, so this question comes up in this group all the time, okay? You have three main options, and I'm going to talk about another one, but I'm not that comfortable with it, so I'm going to leave that to you to do your research for now. But these are the three main options. Number one is group coverage from a previous or your spouse's current employer. This is probably the most desired, I would say. If you can continue coverage from your current employer, some employers do offer that. So I would definitely recommend checking with your HR department that if you want to retire before 65 or before you qualify for Medicare, that you check with your HR department to see if you can just continue coverage through your current employer. typically this group coverage is going to be the best value for the price. Or if your spouse is currently working, it's wonderful if you can stay on that policy until you qualify for Medicare. So that's usually like the number one if you can. Number two is one of the federal or public exchange plans. So these are known as the metal plans. There's 5 levels. So there's catastrophic, which is really for people that are 30 or under, bronze, silver, gold, and platinum. So these are different levels of plans that cover different percentages of your care. And really, the higher the plan, the more expensive it is now. The lower the plan, the less expensive it is now, but the more of the care you would have to cover yourself. So we're going to go more in depth into these plans over the next couple weeks. So I don't want to get too much into that today because we have a lot to cover, but we will discuss those. And there are some benefits to doing things like getting a high deductible health plan and then opening up what's called an HSA or health savings account and putting some money in there. It's almost like another IRA where you can put money in tax deferred. If you use it for medical, it's tax free, and then it also grows tax deferred until you need it later on. So wonderful, wonderful plans if you have some cash built up. And then option number 3 is COBRA. Okay, so COBRA, if you have 18 months or less and you cannot get group coverage from a previous or current employer, it may be a decent deal, versus signing up on the federal exchange. But I would definitely look into that as something as probably your third option of the 3 when it comes to getting your healthcare coverage, okay? Another option that comes up in here that I may do some informational things, but I'm very, 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 very cautious on are these, these so-called like Medicare plans or these, like the Christian healthcare plans. They are lower cost. So I know there was a question about, help me find a plan that I can get for $500 or less until I'm 65, right? These other options here, unless you're getting it from a current employer, are not going to be $500. Or definitely going to be more than that, usually $1,000 to $2,000 a month. But these Medicare plans are gaining steam. They're getting more popular. Here's the problem. So I'm a legal fiduciary, right, when it comes to recommending things for my clients. Overall, these like Christian healthcare ministries and these other potentially these shared services, they have benefits, right? So you're going to usually pay a lower amount per month, but what happens is the money goes into a pot and then that money is paid out to cover people's expenses. There's been a lot of horror stories where folks either have not gotten their expenses covered or they have to pay a massive deductible. One that was shared in this group was like $40,000 that the folks had to come out of pocket before the Medicare plan would kick in. There's also no guarantee that they actually have to pay for any services that may come out. So that puts me in a place where I feel really, really uncomfortable recommending those plans. Excuse me. But if you were between, say 60 or 62 and you're trying to get some coverage between 62 and 65 for a lower cost, you may want to investigate them. But I personally would not recommend them just because the fact that they can actually tell you that we will not cover you, that could lead to big problems, okay? So these are the 3 main options. If you want to look for a lower cost option, you're taking a risk there by doing that, but those Medicare plans may be something to look into. And I may do some education here because I know there's some good stuff out there if there's a big request here for the group, but we'll see. These are your main 3 I would tell you to go through, okay? So now we're going to talk about Medicare. I'm going to do this is going to be a Medicare overview. There's a lot that goes into Medicare and choosing a plan, but we're going to talk about the overall different options here and discuss some things I think you should be thinking about from a planning perspective. So this is some actually like really good information, I think. So I think I would definitely recommend taking down some notes on this. So if you don't have a pen and paper, definitely grab one. Okay. So overall, what Medicare is, it's a social insurance program that is meant to provide hospital medical care for the elderly and certain disabled Americans. It is funded with payroll taxes, the federal government's general revenues, and Medicare recipients will cover some of the costs when they start using the plan. Medicare was signed into law in 1965 by President Lyndon Johnson, who identified the primary goal of the law as follows. When the conference has completed its work, a great burden will be lifted from the shoulders of all Americans. Older citizens will no longer have to fear that illness will wipe out their savings, eat up their income, and destroy lifelong hope of dignity and independence. For every family with older members, it will mean relief from the often crushing responsibilities of Medicare. Okay, so that's the idea. behind Medicare. But since that time, Medicare benefits have been modified and expanded multiple times. In its current iteration, Medicare can be expected to pay about half of a senior's healthcare expenses. So benefits are provided in 3 areas: Part A, B, and D, while Medicare Part C or Medicare Advantage allows private insurance companies to provide Medicare benefits using a managed care model. So as I said, we're going to do an overview here. We'll get some more specifics over the weeks as they come, and also find out what questions you have. But Medicare Part A, so most citizens who are at least 65 years old are eligible to receive Medicare benefits without any medical underwriting. The change in Social Security's full retirement age has not affected the eligibility for Medicare. So as the FRA has gone up, it has not changed the eligibility for Medicare. It'd be kind of scary if they added a couple of years on that, to be honest. So individuals who are also eligible are those on Social Security disability for 24 months and those suffering from end-stage renal disease requiring renal dialysis or a kidney transplant, okay? So unlike the old age survivor and disability benefits, or disability insurance, I should say, benefits of Social Security, Medicare benefits are not affected by an individual's earnings or the amount he or she has paid into the system over the years. So what that means is billionaire Warren Buffett is entitled to the same benefits as the person who tends his yard, right? So that's an interesting distinction between Social Security and Medicare. Okay, so if an individual is already receiving Social Security benefits before age 65, he or she does not need to file a separate Medicare application. She will automatically receive her Medicare card in advance of her 65th birthday. Okay, so if you take Social Security early, which we all know here, I recommend you delay if you can to at least full retirement age, but you don't have to worry about it. You'll be signed up automatically, and you'll get your card before your 65th birthday. If you are not receiving Social Security age 65, then you must apply for Medicare, and here's the phone number. It's 800-SSA-1213. Or you can go to the website, which this is what I recommend actually. Go to www.ssa.gov, or you can visit a local SSA office. I think online is the easiest way. If you like to sit on the phone for hours, have fun, call in. And if you like to just do things in person, you go to the local office, but it can be very time consuming as well. If an individual is not receiving Social Security benefits and is otherwise eligible for Medicare, you should enroll in Part A and Part B during what is referred to as the initial enrollment period, okay? So the initial enrollment period is a 7-month window. It's 3 months prior to turning 65, your birthday month, and the following 3 months, okay? So it's 3 months before your birthday month, 3 months after your birthday month. My understanding and what I've seen is that if you apply early before you turn 65, then it will actually come into effect the first day of the month you turn 65. So if some of you are waiting until you get Medicare so you can quit your job, and you want to quit maybe a week or two early if your birthday's later in the month, then you definitely want to get signed up as early as you can, okay? That's, from what I've seen, that's usually how it works out. But you definitely want to apply within this window. So if you turn 65 and you're still working and you're covered under your employer's group health coverage, you have 8 months following the first month after this group coverage ends to enroll in Medicare Part A and or Part B, okay? So let me just repeat that. If you turn 65 and you're still working and you're still covered under your group health coverage at work, you have 8 months following the first month after your group coverage ends to enroll in Medicare Part A and Part B, or I should say. So this period is referred to as the special enrollment period, and enrollment during this window requires documentation that you were previously enrolled in an employer-sponsored plan. So make sure you have to be able to prove it so that you don't hit the violation period and get charged extra. So if you miss your initial enrollment period, penalties will begin to accrue. So this is what you want to avoid at all costs, okay? So the penalty is equal to 10% of your premium amount for every 12-month period during which you could have signed up but didn't, okay? So this can get pretty expensive pretty quickly. So this is a cumulative penalty. So those that do miss their initial enrollment can enroll during the general enrollment period, which runs from January 1st through March 31st every year, and your coverage would begin July 1st after that. So if anything, avoid that. So individuals do not need to sign up for Medicare each year, but are given the chance to review their coverage and change their plans. So let's talk about Medicare Part A, which is hospital insurance. So Medicare Part A, also known as hospital insurance, pays for medically necessary care that involves an inpatient hospital stay. Part A coverage is provided to most people without a premium payment as long as the individual or spouse has worked in covered employment for at least 40 years, or excuse me, not 40 years, for at least 40 quarters or 10 years. There is no premium for Part A coverage. So similar to Social Security, if you meet your 40 credits or your 40 quarters worth of credits, there's no premium for Part A coverage. If you don't meet that, then you may have to pay something out of pocket. So while, as indicated, Part A is normally premium-free, there are deductibles and co-payments for the services received, and costs for that can add up quickly. So this is why, well, we'll talk about that actually in a second. Let me pause that. Thoughts. So what type of services are covered? Part A, which is hospital insurance, helps cover inpatient care, inpatient hospital care, skilled nursing care, which is inpatient care in a skilled nursing facility, so not custodial or long-term care, hospice care, home health care, which is a part-time or intermittent basis, inpatient care in a religious non-medical care institution. And the health care must be considered medically necessary, and services must be provided in a Medicare-approved facility. Okay, so very important to know that. So from a from a planning perspective, so I'm a financial planner, right? So we always want to look at things from a planning perspective, and take the long-term view and make sure that we're looking ahead when we make these decisions. But if you're eligible for Medicare, but you already have insurance through your job or your spouse's job, in most cases, okay, so please don't take this as advice to your situation. This is just as in most cases type of recommendation. You should opt into Medicare Part A. So, for after all, for most individuals, there's no premium associated with it. So I would generally recommend this. Please don't take this as specific advice for your situation, but since it's cost-free anyways, you should opt in and just take Medicare Part A. So let's talk a little bit about Part B. So Part B is otherwise known as physician's coverage. Medicare Part B, often referred to as physician's covered, covers physician and outpatient expenses deemed medically necessary, such as durable medical equipment, lab tests, x-rays, mental health, and some home health care. Preventative care is also covered. That's important. So in 2018, monthly premiums for Part B range from $134 to $422 depending on income. Part B also requires payment of an annual deductible of $183 in 2018. So this range gets really interesting when it comes to the planning perspective, and this is why it's important to have tax diversification when it comes to your investments and going into retirement. Because if you have all pre-tax money, for example, and you hit 70, and now you have a big chunk of money that's a required minimum distribution, you can actually push yourself into a higher bracket and have to pay more for Part B coverage. So, getting some planning done before you turn 70 to really get this thought out can make a big difference in what you have to come out of pocket for your Part B coverage. So this is where financial planning comes in, and I recommend getting some advice if you do have a lot of pre-tax money. It's really important. So after the deductible is paid, Medicare Part B pays 80% of the Medicare-approved charges, or 50% for outpatient mental care. The Medicare beneficiary is responsible for paying 20%, or the other 50% for outpatient medical care of the approved charge or the co-insurance. There is no out-of-pocket limit related to the 20% co-insurance for Part B. As you can see, these costs are not trivial and are certainly something that you should be aware of as you consider healthcare options in retirement. Some people may view Part B premiums as excessive and decide not to approve initial enrollment. Medicare assumes the individual will be enrolled. Individuals do have the option of opting out by notifying Medicare upon initial eligibility. This is not usually a good idea. Medicare assesses a penalty for late enrollment. So for every 12 months delay in enrolling, there is up to a 10% premium penalty. So even worse, the penalty is cumulative and does not go away. So it can get really expensive. This means that a delay of 5 years can add a permanent increase of 50% to the monthly premium for Part B. Let me repeat that again. The Medicare, for every 12 months delaying enrolling, there is a 10% premium penalty the penalty is cumulative and does not go away. So that means you have to keep on paying it after the fact. So this means that a delay of 5 years can add a permanent increase of 50% to the monthly benefit, to the monthly premium for Part B. Not fun. Not fun at all. So there is an exception to the penalty rule for an eligible individual who does not enroll, occurs because he or she or the spouse is still working and is covered under a group health insurance plan. So this exception, if you're still working, you have group health insurance, don't worry about it. You don't have to necessarily pay that extra fee. Okay. So in this case, there is a special enrollment period that extends up to 8 months after employment, as we talked about before, and or the group health insurance ends. So during this SEP, there's no penalty for the delay. Okay, so if you're still working, you have another health insurance plan, don't worry about the penalty. It's not a big deal. You have 8 months to enroll. So Medicare's supplemental insurance, Part B, provides coverage for physician insurance and for a variety of services that are not covered under Part A. The following list shows the breadth of available services or available benefits, but for an exhaustive list, you can refer to Medicare New Publication and don't download the PDF file at this address here. If you just search Medicare New Publication, a PDF will come up. It's about 150 pages or something like that, but that'll give you a lot of detail into the services. So I want you to note that some of the benefits listed under Part B coverage are similar to those listed under Part A, but remember that Part A benefits normally originate from a hospital stay, while Part B benefits do not. So doctor services, including preventative care and many screenings, ambulance services, durable medical equipment, blood, mental health, home health services, x-rays and lab tests, and limited outpatient prescription drugs. Medical expenses not covered by Part B include most prescription drugs, most dental care, eye exams related to prescribing glasses, dentures, cosmetic surgery, acupuncture, hearing aids, and exams for fitting them, routine foot care, and long-term care. So these are not covered by Part B. As a result of the Affordable Health Care Act and its emphasis on preventative care, Part B enrollees are now provided a physical exam upon enrollment and annual wellness visits annually thereafter. From a planning perspective, Part B has a premium associated with it, so the decision about whether to take it, if still employed and covered under employer's plan, becomes a little bit more complicated. I would definitely recommend working with your Human Resources Department and Medicare to determine if there's any cost advantage to having both coverages. So Medicare Part D, okay, so this is prescription drug coverage. So traditional Medicare Part A and B provided very limited prescription drug coverage. So if you are enrolled in Part A and Part B, or I should say, therefore, individuals who are enrolled in Part A and Part B who don't already have creditable or verifiable prescription drug coverage, for example, from a current or former employer or union, but would like Medicare prescription drug coverage, must join a Medicare prescription drug plan. So these plans are available through private companies under contract with Medicare. People who enroll in Part D or the prescription drug plan pay a monthly means-tested premium, which varies based on the particular plan. Average monthly premiums seem to be around $42 or so, and most plans require the individual to pay an annual deductible and copay for each prescription. Note that Medigap plans do not offer prescription drug benefits, making enrollment in Part D necessary if one is a participant in one of these plans. Most Medicare Advantage plans, Part C, do offer prescription drug coverage, so Part D is not needed. Again, most, okay? So you definitely want to verify this before you select your plan. So the enrollment requirements. People who delay enrollment in Medicare Part D beyond their initial eligibility period may be assessed a penalty, as with Medicare Part B. The penalty is based on the national average premium and the amount of the time the individual is eligible, but went without Part D or other creditable prescription drug coverage. It may be as high as 1% per month of delay. As with the Part B penalty, this premium increase will never go away. So low-income individuals are not penalized for late enrollment in Part D coverage. Additionally, if the individual already has prescription drug coverage from an employer or another plan option, it is unlikely that any penalty will be assessed for later enrollment in Part D coverage. From a planning perspective, there are a number of factors that need to be considered when choosing Part D prescription drug plan. but perhaps most importantly, the individual should compare the list of covered prescription drugs under available plans against the prescription drugs that he or she takes. Next, the cost of premiums, co-payments, deductibles, and co-insurance need to be considered. Comparison shopping is essential to ensure that the plan fits the needs of the individual. Okay, so there's a lot of things to think about when it comes to this. When you go to actually sign up for Medicare and you go through this process, what's going to happen is you're going to land on a page with like up to 30 or 40 options on mix and match plans that give you different coverages, different cost of premiums, co-payments, deductibles, and all the co-insurance. And it can get quite a bit confusing, okay? So if you want to do it on your own, great. If you want some help with really what to select for you and really have that narrowed down, I'm going to talk to you about that in just a second. Okay, so if you would like additional help, including helping with selecting your personal Medicare plan, I have an amazing program that can actually walk you through step by step to help you figure out which plan makes the most sense for you in your state. State to state, you're going to have different options. So if you're interested in getting help with that, I'd recommend going to my website here at kisplanning.com/apply. It's a complimentary consultation initially, so don't worry about any cost there. If we do need to help you select a plan or really any other part of your retirement strategy, then we could definitely talk about what that would look like working together, okay? But this initial call is no cost to you at all. Most people, when it comes to their Medicare selection, like I said, you're going to get 30 or 40 options. So if you want help with that, I have not typically offered that as a one-off service, but we can discuss it if it's right for you. But this is where you would go to discuss working with me. So that's pretty much what I have for you all today. Do you have any questions at all about anything we talked about today? And if you do, go ahead and drop those in the comments, and I'll monitor those for the next few minutes here to see if there's any questions. And then as I'm waiting for that, I will go through and see if you've left any questions for me today. Yeah, Jim's point, make an appointment if you have to go to Social Security office. Absolutely, always make an appointment. Online is definitely the easiest, but you 100% want to make an appointment. So how was this training for you guys? Did you learn something? Was there anything here that you found beneficial? If so, please let me know in the comments. Let me know what one thing that you took away from this training today that will help you when it comes to planning and applying for healthcare and Medicare coverage. I would appreciate that. I'm not seeing any questions come up. If you have questions, go ahead and just leave them, and I'll do my best to go back in there and answer them. I know we had some questions on the previous post. They're a little bit outside the scope of what we're talking about today. So over the next few weeks, right around this time, Sunday at 2 o'clock Pacific time, we're going to continue to dig deeper into the different aspects of healthcare coverage, Medicare, and if you have some specific questions, I'll do my best to actually use those as a case study to answer them for you, okay? But that's pretty much what I have for you all today. If you need help, reach out to me here. Please schedule an appointment or leave a comment, in the group, and I'm happy to do my best to answer those. Thank you so much. I appreciate everybody that showed up today. You guys are the best. And if you have friends or family members that you feel will benefit from learning more about retirement planning, Medicare, Social Security, and all the other things you need to worry about, please invite them to this group. Obviously, it's no charge to join, and I try to do my best to provide really good information for you, okay? So everybody enjoy the rest of your weekend. Have a great time. Stay cool. It's above 100 degrees here in California right now, so I'm trying to do my best to stay cool. And I hope the same for you all. And I will talk to you soon, and I'll see you in the group, all right? Have a great day. Bye-bye.